with offices in St. Petersburg and Clearwater. She graduated from the University of Florida College of Dentistry. Dr. Breyer's expertise includes general dentistry, dental implants, this is why I'm not a dentist, prosthodontics, and endodontics. Please welcome her this evening. Hey, Cindy.
Am I on? Oh yeah, I can hear myself. Okay. um, so today I'm going to talk about dental health and prevention. And this is actually a topic that's very near and dear to my heart, not only because I'm a dentist, but because I grew up in a dental family. So I don't know if you guys... Oh, okay.
If you want to. If you don't want to, you would like to.
I mean, this slide.
Yeah.
Hold on, let me try. Oh, okay, all right. So I don't know if you guys know my background, but both my parents are dentists, and so I grew up in a dental office from the time I could walk. Basically, they would take me out to the office, me and my brothers after school, and we would help them and do all sorts of stuff. And over time, we met all the patients, and they all got to know us, and it truly was like one big family. And our patients would always ask me, the big question is, are you going to be a dentist when you grow up? And the answer, of course, was yes. So after you say yes about 1,000 times, then here I am today. So 20 years later, I've taken over my parents' practice. My mom doesn't really do dentistry anymore. She helps a lot with our office financial stuff, and a lot, especially picks up my kids and stuff like that. So she helps more in that realm. And my dad, he still works, but very part-time. So he'll come and he'll maybe see a patient or two once or twice a week when I ask for his help, because he's very, very experienced. He's done it for over 50 years, and he's extremely good at what he does. So I still get his input here and there and his expertise. So we've been based in St. Petersburg, and we just bought a new practice in Clearwater a couple years ago. So I've been busy working at both ends, basically. So running around like a chicken with my head cut off. So if you see me coming in late, it's because I'm just juggling 5 balls at once, but still trying to make sure my kids come here on Wednesdays and as many Sundays as I can get them here, because I think it's very important, for them too. So anyway, with that, I'm going to get started. And before I get started, I want to say one other thing is I wanted to thank Lexi, my daughter, who helped me with this whole presentation. I really have not done much with presentations and all that, and so she actually had this on her computer. Not this, but is it like a PowerPoint or something? And so she actually helped me to put all of this together. So thank you, Lexi. She's done this with me for a couple weeks now. So she's been very excited. So dental health and prevention. Okay. Oh, so one thing is Lexi and my husband Jason was saying that I need to put in a lot of little cartoons, just kind of help break up things a little bit, break up the monotony of the dental stuff, the boring dental stuff. So here we go. So this actually, we do see this fairly frequently, where people they'll floss a lot, like the day or two before they come in. Okay, so what is oral health? So oral health is defined as a state of being free from mouth and facial pain, oral diseases, and disorders that limit an individual's capacity in biting, chewing, smiling, speaking, and psychosocial well-being. And this is from the World Health Organization. Now, why is oral health important? So oral health is a key indicator of overall health, well-being, and it greatly influences the quality of life. It's important for speaking clearly, chewing, swallowing foods effectively, so you can have a more nutritious diet, and therefore stay healthier. Problems with your mouth can affect the rest of your body, and we know that oral diseases affect about 3.5 billion people worldwide with untreated dental caries, which is cavities, being the most prevalent non-communicable disease. There are many links between oral health and your systemic health, and that's what I'm going to cover a little bit today on, so that if you weren't familiar with how important, your oral health and your teeth and your gums, affect the whole rest of your body, I just wanted to at least make you aware of it. Okay. So this is a little slide that talks about some oral health care facts, and I'll probably just read a couple of them. Oh gosh, it's a little blurry, huh? So 78% of Americans will have at least one cavity by the age of 17, and the number one number one, Americans cite bad breath as the number one unattractive trait in a coworker. And that also has to do with, potentially periodontal disease, or even just not brushing and flossing properly, or not brushing your tongue. 62% of adults ages 18 to 64 visited the dentist last year. So 62%, may sound like a lot, but I don't know, that means, almost 40% didn't. And that's pretty important. And then 164 million hours of work are lost by adults each year due to dental emergencies. So a lot of people come in, because all of a sudden their tooth started hurting that morning, or all of a sudden their jaw swelled up. Children miss 51 million hours of school. So that's definitely a lot. So why is dental health so important? And I was going to read these, but I really can't. I'm sorry, I can't see it all from here right now. But basically, what this says in general is that your dental health affects your overall health, right? And bacteria that are in your mouth can contribute to heart disease, high blood pressure, strokes, rheumatoid arthritis, diabetes, and all sorts of other cancers like pancreatic cancer, Alzheimer's disease. I mean, there's a lot of links, between the bacteria in your mouth and other, illnesses all over the body. Okay, so another little cartoon. I don't know if you guys, can you read it? Sort of. Yes. Okay, so Tooth Fairy, I haven't seen you since I was a kid. And unless you want to see a whole lot more of me, you'll visit your dentist regularly. Get it? Okay. So there's two different type of oral diseases that affect your oral health. And one of them is periodontal disease, and the other is dental decay with cavities. So I just wanted to cover just a little bit about each one. I'm sure you're probably already familiar, but periodontal disease is mainly the result of infections and inflammation of the gums and the bone that surround and support the teeth. It first starts as gingivitis. That's its early stage where the gums become red, they become swollen, and they bleed. So if you start flossing and they're bleeding, then you may have gingivitis. And then if you don't do anything about it, then over time they become periodontitis, which is a more serious stage in which the gums start pulling away from the tooth, the bone becomes lost, and then the teeth may loosen over time as you lose more bone, and then the teeth may eventually fall out. And you can see the picture up there. It shows someone with periodontal disease. They've got, you see the gums are all red, and they have a lot of plaque, calculus, some recession. Okay, so they're most likely going to lose at least certainly some of these teeth, if not all of them, if they don't start taking care of it. Periodontal disease is mostly seen in adults, although there are some aggressive forms in children. And periodontal disease is one of the biggest threats to dental health. And the reason why it is actually is because basically the bone, your jawbone, is what your teeth sit in. And so if you start losing all the bone, then even if you don't have a single cavity, then over time, you just keep, like, let's say your tooth is sitting in here, and over time you keep losing all the bone, then it gets looser and looser, and so your teeth may fall out without one single cavity, and that's periodontal disease. Okay, so these are just the stages of periodontal disease, with the first one being healthy periodontium, where you can see, is there a pointer on this or not really? Oh, there is? Oh, what did I just do? Not that one. Is it the middle one? Oh, cool, okay. So this first one is the healthy periodontium, and you can see this is the bone, is the white part there, and then the pink is the gum above it. And this is actually our ruler. It's called the periodontal probe, which you may be familiar with when you get your cleanings and your hygienist checks all your gum pockets and they call out all the numbers. This is the ruler that we use to check your gum pockets and see how healthy they are. So this is healthy overall, and this is when you start getting gingivitis, which is you can see inflammation of the gums are getting kind of red. See, it's red right here, but you still have your bone. Okay, you have not lost bone, so that's gingivitis. And then when you start losing bone, then this starts from slight or early periodontitis, then it becomes moderate periodontitis as you start losing more bone. And you can see here, and then you can see the pocketing starts getting a little bit deeper. And then as it becomes more advanced periodontal disease, then you lose a lot of bone. You can see this is more than 50% of bone loss. And from here you can see a lot of recession. The gums are really red. The recession you see, like this tooth is probably a goner. You know, these are most likely goners. These two, it's going to depend on how it looks on the x-rays moving too, but it doesn't look very good. You know, so when you start losing all this bone, this is what I was talking about earlier, is that, you know, this will basically cause you to lose all your teeth, you know, with not one single cavity, okay? Okay, so bacteria and other toxins, they start, you know, in your mouth, and then they start in your mouth, they enter your bloodstream through the diseased gum tissue, and that's how they start infecting the rest of your body, okay? And they can, and they cause other issues, as I was talking before, including heart issues, they can affect the lungs, respiratory problems, they're linked to Alzheimer's, strokes, diabetes, colon cancer, obesity, premature births. I also know like pancreatic cancer, a few other things too. So this is, you know, very important, and that's why when we say keep your teeth clean, it's not just because, you know, we care about just the teeth being clean, but we care about the bacteria that's in your mouth that travels everywhere else. So here, this one is, it talks a little bit more detail about all of those different things that I was mentioning. It says gum disease can kill more than just your smile. And so they were talking about here the different things, and I had talked about earlier, with the stroke, respiratory, heart disease, diabetes, ulcers, osteoporosis, rheumatoid arthritis, preterm births, and basically, you know, all of these factors are just really, really important in terms of, for you to keep, like I said, keeping them, you know, the gums healthy, because we see, like, let's say in a stroke, we had a patient who came a few years ago who hadn't been to the dentist in years because it just wasn't that important to him, and then all of a sudden he had a stroke one day, and he wasn't, I don't know, I think he was maybe in his 60s, mid-60s, you know, and it really was a wake-up call. And his physician said, you know, you need to see your dentist. And so then he came to us, and he had periodontal disease, and we had to end up taking out some teeth that were really bad. He ended up having some implants placed. We cleaned him up. He had deep cleaning. And now he comes every month to get a cleaning. Every month he comes, because he tells me every time he comes, he's like, you know, I don't want to die. You know, he's like, I've got 15 grandchildren, and, you know, he's like, I want to see them, and I want to, you know, spend time with my family, and, you know, and otherwise he's a really healthy, really active, you know, great guy. So everything, so he's, you know, he gets it now, you know, so he comes, gets all his work done, and, you know, and so far he's doing really good. So yeah. Okay, so now I'm moving on to dental cavities. Got that? Okay, so dental caries, also known as tooth decay. This is the one that most people are familiar with when you think of, going to the dentist, oh, I have cavities, and this is definitely a very, very big one. So dental caries, commonly known as tooth decay, is caused by a breakdown of the tooth enamel. And this breakdown is a result of bacteria on the teeth that break down foods and produce acids that destroy the tooth enamel and result in the tooth decay. Although dental caries is largely preventable, they remain the most common chronic disease of children and adolescents. It also affects adults, with 9 of 10 adults having tooth loss. The key is the word largely preventable. So, and that's what we're talking about today, is that actually a lot of the stuff that, you're seeing, we actually can prevent nowadays. There's been a lot of research, and things I'll, show you later on, can actually prevent people from getting cavities. So 1 in 4 Americans, adults, have untreated tooth decay. This equates to almost 2.5 million adults in Illinois. So I don't know, I saw this fact and I just thought that it really makes you think about, people, having a cavity, but let's say it doesn't hurt you. So that's one of my biggest challenges is I tell people, oh, you have 3 cavities, and they say, oh, but it doesn't hurt me, so they don't come back. And then all of a sudden, a year, 2 years, 3 years later, they come back, and all of a sudden now it's reached the nerve, and now they need a root canal or they need an extraction. Actually, I had a patient yesterday who, the exact same situation where she was a snowbird from New York, and she comes down 6 months here, she's up 6 months there, and 4 years ago, I did an exam on her, and I told her she had like a cavity in this one tooth under a bridge, and then she went back up to New York, said she'd get it done up there. Apparently she didn't, because then she came back to me yesterday, and it was hurting her, and so this one little cavity that she had 4 years ago now was huge, and it bombed out her whole tooth under the bridge, under the gum, under the bone, and now she has a big infection, and now she needs it taken out. She needs an implant, or, a denture or something else, because it was part of this whole long bridge that she had. And she was pretty upset yesterday when I told her, and then she's like, well, can I wait till May when I go back up to my dentist in New York to get this done? And I was like, listen, we're at the beginning of February right now. You've got a couple months to go, but I can't predict the future, but I can tell you this is a ticking time bomb at this point. You've got an infection. You came in because it's already hurting you. Do I think you can wait until May? I don't know. Good luck, right? But so that's why when the cavities are small, that's the time to fix them when you're just doing a little filling, okay? Types of dental caries. So there are 3 types. The one that we see the most is in between. Actually, let me correct that. I really think it really depends on where you are in your life. The one that I usually do the most of is the ones in between the teeth, okay, and those are called smooth surface cavities, and they're mostly in between because people don't floss so much, and so then food gets stuck in between the teeth, and then it sits there for however long until you decide to floss it out, right, because brushing's not going to get it out, and then over time it starts causing a cavity, and so these, these are fillings are a little bit more challenging to get into than the ones that are straight on the top. Okay, and these cavities are called pit and fissure cavities because they're right in the grooves here of your teeth. And these 2 are more, I see, more younger adults, younger middle-aged adults. The root decay, the one that gets under here more, I see more in elderly adults when the bone is pulled down, the gum has pulled back, and then you start getting cavities down at the root surface. And a lot of that happens, especially when over time as we age and then we start taking more medications and we get dry mouth, and then all of a sudden these cavities can go from like 0 to 10, and sometimes I see it in like 3 months, 6 months. I mean, it's really insane how fast they can develop. Stages of caries development. So it starts in the enamel, which is this outer layer, which is the white part here. And when it's in the enamel layer, you can actually heal it. So when it's only in the enamel, there are things that you can do to heal this without having to get a filling, and I'll talk about that more in just a minute. But if you don't do anything, then it goes into the dentin, the second inner layer of your tooth. Okay, and by the time it reaches the dentin, then you've got to fix it. Otherwise, the next stage is the nerve. And once it reaches the nerve, then it will cause the pulp to get inflamed, the pulp, which is the nerve, and you get what's called pulpitis. And that's where you start getting pain in your tooth, a toothache. And if you still don't do anything then it'll go past the tooth and go out into the bone and go past into the periodontium, right? And it causes a periodontitis, and that's where you get an abscess. And it's rare, but people have died from dental abscesses. Actually, one of my dental assistants, her brother died from a toothache, and that's how she got into the dental field. And every time she talks about it, she cries, and he was very young. So it's, it can be pretty serious. Okay, so this next slide talks about tooth decay, and the main bacteria that causes it is Streptococcus mutans. And basically, the way it works is plaque starts forming on your tooth. It's like a soft layer of film, and then it's self-formed with bacteria, dead cells, food debris, and then over time, if you're not brushing and flossing, getting it out, then it mineralizes and it hardens to become calculus, or that tartar buildup. And that's like the calcium in your saliva. It gets on all that soft plaque and it hardens it. Okay, and then by the time it hardens it into calculus, you really can't just brush it out with your toothbrush anymore. Even if you use super hard, those hard or medium or hard toothbrushes, they don't get it out. You really need like one of those toothpicks or something harder than that to actually scrape it off, okay? And actually, on a side note, just to let you know, dentists do not recommend medium or hard toothbrushes. They are too abrasive. Not only do they wear down your teeth, they will literally wear away your gums. And so we've seen so many patients over the years who, they use the hard toothbrush because they think it cleans cleaner, and then you tell them, and then they switch to the medium toothbrush because they think it's going to be a nice compromise. The medium is still way too hard, and so if you're already, brushing with a heavy hand and you use a medium or hard toothbrush, you're pretty much going to wear away your teeth and your gums, okay? But not remove the calculus. And so basically there's not, prevention is, brushing, flossing, fluoride, and other things. Caries balance. So these are two things here. It's like an acronym. One for the disease-causing factors, BAD, which B stands for the bad bacteria, which is like the acid-producing bacteria that causes cavities. Absence of saliva, which is A. So what I was telling you earlier about saliva being really important in your mouth because it bathes your teeth, it neutralizes acids. So if you have an absence of healthy ciliary function or dry mouth, then you're going to get cavities, and you're going to get it very rapidly. And then dietary habits is D. So if you have poor dietary habits, like you eat a lot of sugars, acids, you end up getting more demineralization, which means a weakening of the enamel. And the sugars and everything causes your pH in your mouth to be lower, more acidic. And the bacteria thrive, in that environment. Your enamel starts weakening, or basically it becomes more porous. So you think of porous like a sponge, porous. And then over time, that's how you become, you get more decay, and that's how you literally get a hole in your tooth, is that, the porosity from all the acids and the bacteria comes in there, and then before you know it, you have a cavity. Protective factors, the acronym is SAFE. So S stands for saliva and sealants. So saliva neutralizes the acids, encouraging good bacteria to thrive, aids in remineralization. Sealants seal the chewing surfaces of teeth, most likely to cause decay. So the sealants would seal the top surface of the teeth. And I don't know if any of you have had sealants before, but they really do work as long as they're on there. The problem with sealants sometimes is that over time, as they start chipping, because you're eating, over a period of years, you're eating all sorts of stuff every day, especially the harder things you eat, will start chipping away your sealants because it's just like a layer of paint on top of your tooth. And if it starts chipping and you start getting, like it's not sealing anymore underneath that sealant, then bacteria can get underneath there and it can start causing a cavity. So if you get sealants, then you have to come like every year and get your sealants checked to make sure that they're still on there and they're sealing and they're doing their job. So sealants in general are very good. Like I have, my children all have sealants and I check them every 3 months to make sure they're on there. And I clean their teeth every 3 months. But, you know, but if you don't keep an eye on those sealants and you think you put them on there and that should last for a lifetime, then you're going to have problems. Okay. So I think I talked about saliva and sealants. A is antimicrobial, so those help get rid of the bad bacteria and promote healthier bacteria. F is fluoride, so strengthening tooth surfaces against demineralization. It helps to promote remineralization. And then E is an effective diet, so eating, you know, a healthier diet, low in sugars and acids. Okay, so this one, I don't know if anyone's ever had this experience where we crammed like 15 cottons in your mouth and put a high speed and a mirror and everything else, cheek retractor. But this guy's gonna try to squeeze in a tennis ball on top of all that. Okay, so now I wanted to just talk about the oral microflora a little bit because this is actually going to lead into the prevention stuff that I was telling you guys about. So the oral microflora, this is something that, you know, back decades ago we weren't as familiar with in terms of for prevention, you know, but there's been so much research now that's shown how important this is on a bacterial level, okay? So oral microflora definition, so it's bacteria and other organisms that normally inhabit the oral cavity. And the average adult mouth may contain 500 to 1,000 different types of bacteria with 100 to 200 species living in there at any given time. Presence of nutrients, epithelial debris, and secretions make the mouth a favorable habitat for a great variety of bacteria, you know, good and bad. The normal flora serves as a barrier to colonization by pathogens, and oral bacteria include Streptococcus, Lactobacillus, Staphylococcus, and a number of other anaerobes. And these are just some different, bacteria in the oral microflora here. So now the oral microflora in a disease state. Some types of bacteria are more resistant than others, subject to our body's host response and genetic variables. And if we go for 24 hours without brushing, the bacteria in our mouths can go from 20 billion to 100 billion, resulting in a maturation of the dental biofilm, which is like all that plaque in your mouth, and more pathogenic bacterial complex living in our mouth. You know, that's why I was saying it's so important to brush and floss all the time because these bacteria grow very rapidly. So I don't know if you've ever had that experience where, you know, let's say you forgot to brush one night and you fell asleep and, you know, you didn't brush and you wake up the next morning and you just feel like your mouth just feels so slimy and, you know, and just, you know, yucky, right? That's all the bacteria growing in there. Pathogenic microorganisms in our mouth can cause dental diseases such as bad breath, tooth decay, periodontitis, endodontic infections, and eventual tooth loss. Okay, so this is actually just a picture of, this is your tooth surface, and this is an acquired pellicle. So that was what I was just telling you about, is there's the early colonizers, all these bacteria here, and then over time, you start getting, you know, later colonizers. You can see, you know, there's just a lot of bacteria. You know, some of them are good, some of them are bad. But the key is we want as many good bacteria in our mouth as possible. So you think of it kind of like, you know, like we talk about probiotics in our gut. You know, you want all the good guys in your gut. So your mouth is the same thing. Okay, so this one, broken yo-yo. So now I'm moving on to the dental prevention essentials. An ounce of prevention is worth a pound of cure. And so these are different things that I'm going to cover. And, you know, and these, it's more like, you know, the more you do it, I think the more healthier, you know, your oral health will be, right? But And I think most people are at least familiar with probably a few of these things. But I'm not sure if anyone's familiar with oral probiotics. So I was just talking about gut probiotics, right? So everyone knows about yogurt and having a good gut flora and all that. But so the oral flora is the same thing, where we want to have a good bacterial flora in our mouth. Those are all the good guys in there. And when you have like a good bacterial flora, then you're going to have less chance of getting cavities and getting periodontal disease, because the bacteria that causes the cavities and causes periodontal disease, they're not as prevalent in there. So, so even if, let's say, you didn't brush quite as much, but you're still going to have a healthier mouth in general because you have good bacteria, okay? So this actually helps you to do that, and these are called oral probiotics. Probiotic means in favor of life, and oral probiotics are healthy bacteria that works effectively in restoring the oral microflora to its natural diverse state by altering the oral bacteria count to be healthier. Good bacteria are freeze-dried and made ready to be rehydrated by a patient's saliva, and inside the mouth, the rehydrated good bacteria crowd out and replace the bad bacteria, promoting tissue health and eliminating acid-producing strains of bacteria that causes dental decay. So the results of taking something like an oral probiotic is you get a reduced plaque and biofilm that forms in our teeth, reduced bleeding of the gums, and healthier oral flora, which means a healthier mouth. The next one is xylitol, and that one is, xylitol is actually a natural sugar substitute, and I've heard that actually people in Europe use it a lot more than Americans do, but it's actually good, for your dental health. Actually, here, let me read through this. So basically, it occurs. It's a naturally occurring sugar substitute. It's manufactured from birch trees, corn cobs, plums, strawberries, raspberries, and when sugars are consumed, the acid is produced, creating a highly acidic environment in the oral cavity that weakens the enamel and increases cavities, which we discussed. So xylitol, it's not metabolized by the bacteria in the mouth, so therefore it doesn't result in acids being produced that cause tooth decay. And that's really important, because normally, the bacteria that causes cavities, they love sugar. So if you switch sugar to xylitol instead, for your sugar source, shall we say, then the bacteria cannot metabolize that, and they can't use that as their energy source, and so therefore they starve and they die basically by starving. So the xylitol sweetness also stimulates saliva flow, which neutralizes acids that have been formed, and it rinses away excessive sugar residue, and it helps to keep an alkaline environment in the oral cavity that's inhospitable for bacteria. And it also reduces the amount of plaque and strep mutans in the plaque, which is that bacteria I was telling you that causes cavities. Okay, so xylitol is, it's really good. And they've done research to show that if you take 6 to 10 grams of xylitol 3 or more times a day, it could be effective in decreasing the strep mutans level in your plaque or saliva. But it's got to be that. If you take it only once or twice a day, you're not going to really get the desired results. If you take too many a day, like over 40 grams, you may get a mild laxative effect. And it's dangerous for pets, so you do not let your dog or cat, swallow one of those, because they could get really sick. The next, I'm sorry, what? Mm-hmm. Yeah, xylitol. So this one I was showing you, that one actually is sugar-free gum. I think that one's called Epic. But there's also, the other one I showed you was Spry. So Spry has like mints, gums, candies. They have rinses. I mean, there's all sorts of stuff. If you look online, xylitol is, it's everywhere really. You can buy it at like Roll Oats. That's where we buy ours. I've bought it at the vitamin shop. I usually get it online just because it's easier for me. But yeah, it's everywhere, and it's pretty cheap. It's not expensive at all. So my kids, if I have them chew gum, I have them chew xylitol gum, xylitol mints. Perisciences, that's an oral antioxidant, and that's more for people who have gum inflammation. So we're talking about, periodontal disease, gum inflammation, right? So antioxidants are compounds that inhibit oxidation, which is a chemical reaction that can produce free radicals, leading to chain reactions that may damage the cells of organisms. So Period Sciences, it works with your body's natural defense system, saliva, which has natural antioxidants and antibacterial agents to enhance the salivary system. So usually we'll have patients who have like really bad gum inflammation. We clean their teeth and then we have them use a round of this Perioscience to help, decrease, the inflammation. And it also helps a lot of times when people have a lot of restorations in their mouth, like a lot of fillings and crowns. It can help decrease the inflammation on there too, because sometimes if you have a lot of restorations and they're not quite like even, they're like a little bit, like let's say jagged, or there's a little overhang or a step, bacteria gets in those areas, and the Periosciences helps the gums to be, just less inflamed and healthier. Fluoride varnish. Now this is something most of you are probably familiar with. This is normally when you get a cleaning, then your dentist will put like a layer of fluoride varnish on your teeth, or they'll ask you to put it on, right? And the reason why we recommend this is that it's actually a protective coating. So you'll see here's a fluoride varnish, and this is under a scanning electron microscope, so it's blown up a lot. But you can see this is actually the layer of the fluoride on your tooth. This was actually taken a month after the fluoride was placed on by a patient. They put it half on one area and the other half they didn't put on, and then they came back a month later and they took a picture. And you can see it's still on here. So this is your natural tooth surface. These are all the dental tubules, these little tiny microscopic tubules that run into the nerve. And so sometimes you wonder why you may have sensitivity. If you eat a lot of acidic foods, these tubules will get a little bigger, and then that's how you start, getting more sensitivity. So then if people come in who are sensitive, and I had a patient once who came in and all of a sudden she just had a lot of sensitivity back here and she had some recession. And I was like, well, have you done anything different recently? And she's like, well, there's been a lot of, I guess it was like citrus season. And she's like, I've been eating a lot of those little cuties. And she's like, because they're so good and they're in season right now. And so she's been eating so many of them, and all the acids, in those cuties was causing all the sensitivity. So we put fluoride on, and then, she felt better. But that's what the fluoride can do. So it provides like a smoother, slicker layer, protecting the teeth from food particles adhering to the tooth surface. You can actually see some food particles sitting here, right? But when it's on here, it doesn't stick as well. So it's kind of like, let's say car wax. You put car wax in your car and the water just beads off. That's what fluoride varnish does. But it won't last forever. We say maybe around 6 months, give or take. So that's actually very, very helpful. Okay, so this one, I'm going to read this one. So my daughter loves bacon, and so do I. So my dentist says, bacon and soda works just as good as toothpaste. That's baking soda. You can imagine bacon and soda. Okay, so the next one is this particular toothpaste called ClinPro 5000. And 5000 stands for 5,000 parts per million of fluoride. This is a prescription strength toothpaste that aids in preventing cavities, strengthens enamel, and it reverses demineralization, or sometimes you get some white spot lesions on your teeth. Those are areas where the enamel is weaker. Okay, it's demineralized. It's more porous, basically. And what we like about this, it says it's throughout the teeth, not just on the surface. This particular toothpaste works very effectively in terms of reducing and actually reversing decay if it's in enamel. Remember earlier I told you about the enamel cavities when it just starts in the enamel? This is what you would use in order to reverse it, and you can literally heal those cavities. It's because it contains tricalcium phosphate, which aids in the uptake of the fluoride in demineralized areas. And the reason why this is a little bit different than some of the other toothpastes is that, we used to just say, oh, well, fluoride, you just use fluoride and it'll help. But then over time, sometimes you would see some patients, they'd use a fluoride toothpaste and it would work, and other times someone would use it and it wouldn't work so well. And then 3M, they did some research and found out, yes. Oh, okay. So they did some research and found out that some people's saliva, oh no, okay, have, some people's saliva have less of the calcium and phosphate that would help in the reuptake, and so that's why this toothpaste has those ingredients also, okay? Um, yes, it's a prescription only. Like $20 or something. One tube, but it lasts about 6 months. Yeah. And so it is expensive for a toothpaste, but very inexpensive in terms of the big picture versus doing fillings or crowns. So this just talks about fluoride and how it works. I'm going to probably move a little faster. So Sonicare, so basically, Sonicare is my most favorite electric toothbrush because of the ultrasonic technology. Now that's the same technology when you get a cleaning and they use that ultrasonic machine. Your hygienist uses it. This is the same technology, and that's why we really like it, because it has like 31,000 brush strokes per minute and really cleans your teeth well. But quite honestly, any electric toothbrush I think is going to be better than manual. So if you like Oral-B, that's a great toothbrush. There's so many new brands out there now too. So anything that gets your teeth clean is what I recommend, okay? Oh, one thing about the Sonicare I do like, and a lot of other toothbrushes have it that I would recommend if you do get an electric toothbrush, make sure you get a 2-minute timer and make sure you get a pressure sensor. That is super important because remember I was talking about brushing too hard? Those are the two big things. Okay, so now I'm moving on to the ortho. So this one, my daughters have braces, and so it says, I hate my braces so much. Where's the wireless technology when you need it? Well, we have it now. So orthodontics and dental prevention. I actually added this because, we found more recently that orthodontics is so critical in maintaining healthy teeth. It's not just about doing braces so your teeth look good. A lot of people have the misconception that, oh, I don't care if my teeth are crooked, I don't care how I look, it's fine and everything. Well, I don't really care about the aesthetics as much either. I care more about you keeping your teeth for the rest of your life, if that's what you want, right? So braces and orthodontic treatment are used to correct malocclusion, which is the teeth that are crooked. And correcting malocclusion can give you a pretty smile, but it can also result in a healthier mouth. If you don't correct it, then you can have further health problems, including tooth decay, abnormal wear to the tooth enamel, periodontal disease, affected speech and chewing, and jaw problems. And this is actually a short, maybe 2 or 3 minute video by Invisalign. Are you able to click on? Okay.
Everyone knows that straight teeth give you a beautiful smile. Did you know that straighter teeth can also affect your overall health? Crooked or misaligned teeth, also known as malocclusion, affects 74% of American adults. Left untreated, crooked teeth can lead to periodontal disease and create abnormal amounts of stress on teeth and jaws, which can lead to premature wear. The
So, yeah, it's done. That one's done. So I think I'm just gonna just show you a couple of cases about like teeth that are crowded, and then I was going to talk about traditional braces. I'll probably just go through this. You guys are familiar with traditional braces, right? The brackets, the wires, and everything. So visibility, you see them. Removability, you can't. Comfort, not quite as comfortable, but you get used to it. Hygiene, very difficult to clean in between. And then diet, you've got to be very careful not eating hard, sticky foods because it'll pop off or break. So now new technology is clear aligners, and Invisalign is just one type of clear aligner. There's many different brands. I like Invisalign the most because it's been around the longest. It's got the most research with it, and I think in terms of results-wise, it gives you the best predictable results. But that's what you were seeing. That video was talking about that, and they're just clear aligners you take on and off and everything, and that's what we do more of in our practice, especially for adults, because no one really wants to wear the brackets and everything. But the key is you've got to wear it like 22 hours a day, okay? I'm going to go through this really fast. But I wanted to show you a few cases and everything. And I think, Chris, we're probably not going to open up the video on them. We probably don't have time. But I just want to show you a couple of things here so you can see this is someone who's got crowding. And you can see the teeth that are more shifted in, or the ones that are way out and down here. You see all the plaque, calculus, how red the gums are. You see how crowded these teeth are here because they can't clean them. You see how crowded the arch is and how it's kind of very narrow and constricted. So now once they've straightened it out, you see how wide this arch is compared to that. That's the upper arch. You look at this lower arch and compare to that. And doesn't that look so much healthier? And they're able to clean it so much better, right? So I just said, oops, sorry, I'm going to shift. Oh, this just shows how it straightens. We can just keep moving on, Chris. I don't think we'll have time to do them all. Or you can just see it really quick, one example. But that's how they do it, is that literally this is how your teeth move. So what's cool about the new technology is that when they say, this is how it's going to happen, this is literally how it happens. There's no, questions about will you get to that result or this or that, as long as you wear them. The next one, this is actually a young person. I think she was like 28. And she had all these cavities, and you see all this crowding. And the arch, again, very narrow. You'll start seeing a common theme here, very narrow, constricted. Some of the teeth are shifted up. And once they straighten them, here you can see, and then put crowns on them, that's just a healthier mouth. And this is something she can actually keep, for the rest of her life, as long as she keeps them clean. Versus these, basically, she was going to end up losing these over, another, I'm not sure how long, which depends, right? Oh, sorry. Can we shift to the next one? Okay. So this one, similarly, this one's actually more of an open bite, but you can see the crowding. This is really severe. So you would start end up losing these teeth if you're not able to clean them. And I guarantee you no one can clean these. It's super difficult, and that's where you get all these cavities too. You see the end result similarly. You see that. So let me see if I get to the next one here. This one is actually, instead of crowding, this is more the spacing, but yet there is crowding. So that tooth is hiding behind there. And so you absolutely cannot clean this tooth. Like, this is nearly impossible. When it's triangular shaped like this, pretty much 9 out of 10 times people will get cavities in here because you just can't even floss or brush it. So once they straightened it, oh sorry, there's a second one. Once they straightened it, you see now it's cleansable, okay? And then this one's sticking out, and therefore the other one's sticking way in. So if you don't fix these teeth, then you end up losing them. You start losing this one starts shifting more, you lose the bone, then you end up losing this one. Before you know it, you lose your front teeth, and that's how you shift yourself from going to having all your teeth to going into partial denture, full dentures, okay? And this is here much healthier. Another thing I want to show you is, see how these teeth, you can barely see the bottom teeth, but now you see more of them. What we do is we literally intrude the teeth in the bone, by pushing them. We push them back in so that they're healthier and they're in the bone. This is another good example of that, where you see these teeth don't look so bad, right? Except look how high this one is up here. And now here what we've done with Invisalign is we literally push them back down into the bone so that they're healthier and they're more they're deeper in there, so then, you'll be able to keep them cleaner and just maintain them. Okay? This particular case, this person, you can actually see their tongue. They have a really bad tongue thrust. So you can see they're just pushing all the teeth out. And if you don't straighten them, and this one, not only you have to straighten them, but you've got to put a fixed retainer, like a fixed wire on the upper and lower, because if you don't, the tongue is so strong, it'll keep pushing it. And even with that fixed retainer, you actually need to double duty it and do a fixed one and then a removable retainer to cover over all of that, because what will happen is the tongue is so strong that it'll keep pushing them, so then all 6 of them will come out together and leave a space behind here and here. And I see that. I've seen that a few times, actually. So you need a double duty retainer, fixed and removable. And then this one I put in there just to show you. See, this doesn't look bad. When you look, someone smiles, no big deal. But you see, you don't see those teeth.